Yes, good afternoon, Miss Yowell and Miss Jaffe. Many thanks for meeting with us. I understand you're going to tell us about the big code changes underway and how to cope with them.
Well, hi, I'm Becky.
And I'm Ellen, and we're here at the APA to answer CPT questions. Lately, we've been swamped with questions because of the changes that have occurred to the CPT codes for psychiatry. We try to answer every call and every email we get as promptly as possible. I like to say that I think we're running at least 2 or 3 days behind now, since calls and messages come in over the weekend when we're not here to answer them. But
I think some of the most frequently asked questions include, now what do I do and how do I code in 90805 or 90807? And now that 90862 is gone, what is the appropriate code to use? So we want to encourage everybody to think about their practice patterns, identify the codes they use most frequently, and then check out the APA website for information on how to bill and code, in particular the E&M codes. I think most psychiatrists are struggling with understanding that E&M coding concept, so there's materials on the site that would be helpful. I think if you narrow down the range of information that you need to know, if you have just an outpatient practice, the E&M codes that you need to focus on are, for instance, the 99211 through 99215 series. So look at those, get comfortable with identifying the level of work required, the types of problems that patients are that you're treating patients for, and how they fall across those range of services. But I think part of what we're hearing is people are feeling overwhelmed with the changes, and we want to encourage that you really kind of focus on what your practice is doing and try to narrow down the scope of information that you need to understand.
That's a good point, yeah.
Becky and I have a regular Q&A webinar on most Tuesdays and Thursdays when we're able to, and you can access those webinars and get your individual questions answered by going to the website and looking under webinars and then signing up. We think this is a really good way for, you can get your individual questions answered without having to wait in the queue for when we get back to you. Also, since many of the questions you will have are the same questions that your fellow psychiatrists have, you may hear the answer even before you asked it. But that's one way. Also, members of the Committee on RVS Codes and Reimbursement are having webinars, live webinars, some evenings. And if you look on the website, you can find that schedule as well and sign up for them.
And for those, we actually record those webinars with the committee members, so they'll be posted on the APA site and available even if you can't make the live webinar.
Okay, that's a wonderful suggestion. Yes.
So again, I guess if you have individual questions and you don't want to wait to the Q&A or the webinars, you contact us through the APA Practice Management Helpline. That's 800-343-4671, or send us an email at hsf@psych.org, and Ellen and I will do our best to get back to you as soon as we can.
We'll get back to you eventually.
Eventually, for sure. Thank you so much, ladies.